Welcome to This Explainer. Today, we're going to demystify rheumatic heart disease. We're mapping out the surprising and honestly kind of terrifying biological chain reaction that causes it. It's absolutely fascinating to see how something as incredibly common as a simple sore throat can literally transform into a severe, life-altering cardiovascular condition if it's left unchecked. But hey, as we'll find out, knowledge is absolutely our best defense here.
To make sure we grasp this complex medical timeline, we'll follow a clear roadmap. We're going to look at a dangerous chain reaction, how the immune system misfires, the resulting damage to the heart, how to spot the warning signs, treating the damage, and finally, stopping the chain completely.
Let's kick things off with Section 1, a dangerous chain reaction.
We really have to begin by looking at the global impact of this. Rheumatic heart disease is a massive cause of cardiovascular disease in children and young adults, especially in low and middle-income countries. It's a disease that thrives in areas where there's limited access to healthcare, overcrowded living conditions, and, well, repeated untreated infections. But here is the most crucial thing I want you to take away right now. While this disease is totally devastating, there's immense hope because it is completely preventable.
The journey from a totally mundane trigger to permanent fallout follows a very clear 5-step path. And surprisingly, it doesn't even start in the heart. Step 1 is just a basic bacterial infection of the throat. You know it as strep throat. If that isn't treated, we move to Step 2, which is rheumatic fever. That's an intense immune reaction. That reaction sparks Step 3, severe inflammation of the heart valves, causing them to swell up. Over time, that swelling leads to Step 4, which is permanent scarring and damage. And finally, that irreversible scarring brings us to Step 5, the chronic condition we call rheumatic heart disease.
Moving right along to Section 2, the immune system misfires.
So the absolutely crucial window here is exactly 2 to 4 weeks. After an untreated or even poorly treated strep throat infection, that is the exact time frame it takes for rheumatic fever to set in. It basically creates a ticking clock for medical intervention. If a child has strep throat, that 2 to 4 week period is when the bacteria are quietly triggering a massive systemic problem.
And what is that systemic problem exactly? Well, think of rheumatic fever as a friendly fire scenario. The body's immune system recognizes the streptococcal bacteria, right? So it ramps up an attack to destroy it. But then it misfires. The antibodies get confused and literally start attacking the body's own healthy tissues. So while it heavily targets the heart, this inflammatory assault also ravages the joints, the skin, and get this, even the brain.
People actually mix these two terms up all the time, but the difference is super critical. Rheumatic fever is the acute, immediate battle. It's a temporary, highly inflammatory storm right after the infection. Rheumatic heart disease, on the other hand, is the lifelong, chronic war. It's the permanent structural wreckage left behind on the heart valves long after that initial fever has passed.
Okay, Section 3, damage to the heart. Let's look at the actual wreckage.
As you probably know, the human heart relies on 4 vital valves to keep blood flowing in the right direction. And while several of these valves can get caught in the crossfire of rheumatic fever, the mitral valve is by far the most frequent victim of this scarring. It sits right between the left atrium and the left ventricle, handling highly oxygenated blood. The aortic valve is the second most likely to take damage, while the tricuspid and pulmonary valves, they're far less commonly affected.
So what does this damage actually look like in practice? This structural breakdown is really the absolute core of the disease. The immune attack leaves thick, stiff scar tissue behind. And that means the delicate flaps of the valves can no longer move freely. They either become rigid and narrowed, a condition doctors call stenosis, which makes it incredibly hard for blood to push through. Or the flaps become totally deformed and fail to close completely, known as regurgitation. That allows blood to leak backwards. In either case, it physically prevents the heart from efficiently pumping blood throughout the body.
That brings us to Section 4, spotting the warning signs.
There's a really stark difference in symptoms between the two phases. In the early, frantic, acute phase, the warning signs include fever, severe sore throat, joint pain, skin rashes, and even involuntary, jerky body movements known as Sydenham chorea as the brain becomes inflamed. But the chronic fallout of the heart disease, that can take years to fully appear. Once the heart starts to struggle from those scarred valves, patients experience shortness of breath during just basic activities, swelling in their legs and feet from fluid buildup, heart palpitations, and even fainting spells just because of the poor blood flow.
Now, if those chronic symptoms are ignored, or, as is often the case, if medical care just isn't accessible, the stakes escalate dramatically.
The overworked heart muscle can eventually give out entirely, leading to heart failure. The stretched and strained heart chambers can develop severe electrical problems, like atrial fibrillation, where the heart beats erratically. And that chaotic beating? It can allow blood clots to form, which can travel to the brain and cause a stroke. Damaged valves are also highly susceptible to further bacterial infections, called infective endocarditis. And tragically, in severe, untreated cases, this whole chain reaction leads to premature death.
To confirm this damage before it ever reaches that fatal stage, doctors rely heavily on echocardiography, basically an ultrasound of the heart. It's the single most important diagnostic tool they have. It lets cardiologists actually peer inside the chest in real time, physically see the scarred, thickened, or leaky valves, and precisely measure the severity of the stenosis or regurgitation. They'll use this alongside ECGs to check the electrical rhythm, and blood tests or throat swabs to look for evidence of that initial streptococcal infection.
Now, let's talk about solutions in Section 5, treating the damage.
Because the existing valve damage is largely permanent at this stage, the focus of treatment shifts entirely to managing symptoms and easing the massive burden on the heart. To handle the swelling, doctors prescribe diuretics to help the kidneys flush out excess fluid. To tackle the erratic heartbeat, they bring in beta blockers and antiarrhythmics. And anticoagulants are absolutely crucial for thinning the blood and stopping those stroke-causing clots before they even form. But when a valve is just too far gone, medication simply isn't enough. That's when surgeons have to step in and either repair the damage or completely replace the failing structure with an artificial or biological valve. And the journey doesn't end in the OR. Patients then face intense cardiac rehab and physiotherapy just to safely rebuild their basic exercise tolerance.
Finally, we've arrived at Section 6, stopping the chain completely. Look, because existing valve damage can't just be cured with a pill, prevention is literally the absolute best strategy. The most crucial takeaway from this whole explainer is this: a simple, early course of antibiotics, like penicillin, administered during that initial sore throat phase, stops this entire devastating chain reaction dead in its tracks. It kills the bacteria before the immune system ever even has a chance to misfire. This is exactly why prompt medical evaluation for severe sore throats, especially in kids, is so critical. On top of that, patients who have already experienced rheumatic fever often need long-term prophylaxis, meaning regular, ongoing antibiotic doses, just to ensure they don't get another strep infection that would cause even more valve damage.
I'll leave you with this final thought. How incredible is it that such a severe, lifelong cardiac disease, one that can require open-heart surgery and lifetime medications, can be completely prevented with a basic, inexpensive antibiotic? The chain reaction is devastating for sure, but our ability to break it is absolute. The tools are already in our hands. So the real question is, will we step up to ensure every child gets the basic care they need before that ticking clock runs out?